want to take a moment and speak out against systemic racism and the inequities in healthcare that currently exist and plague our society. And when I say plague, I mean it plagues all of us. Certainly the health inequities disproportionately impact people of color, and in particular the Black community. But it is a plague on all of us, and we need to address it right now. This is the moment. So I feel compelled to speak out. I want to make a difference. And I think using my voice and my platform is one way I can do that. But one of the things that frustrates me is that when people talk about the protests and everything that's going on around our country, they tend to focus on police violence. And yes, police violence, we need to address it. It is a problem, no doubt about it. We can't allow police across the community, across the country, to continue to kill innocent Black men and women. But this is about far more than that. When you look at health inequities in our country, their impact is far more lethal than what we see from police violence. It's just unseen to a lot of us. And honestly, in the healthcare industry, we've known about this for a long time. I mean, we understand that Black Americans die from chronic disease at much higher rates than white people. But we haven't done enough about it. We have certainly done some, but we haven't done enough. And we've allowed it to be the status quo for decades. And my concern is, even if we have some interest in addressing these health inequities today, can we sustain it? And by the way, I don't think we've gotten people's attention. I'm not sure this is a priority for people in healthcare today. It needs to be, but it is not at the top of their list. So we need to keep pushing and talking about this and sustain this conversation until action takes place. Because that's what it's going to take. It is too easy for us to slip back into business as usual. And we can't allow that to happen. We've allowed business as usual to take place for decades. We've sat by and watched communities of color be underserved. We've watched the Black community suffer from COVID-19 in a way that is unparalleled by any other group in America. I mean, Black people die of COVID-19 at a rate that's nearly 3 times that of white people. There's just no excuse for that to happen. But the reason it is happening is because of a long history of systemic racism. This is intentional. This is the result of decades of legislation, of policy initiatives, of business practices that have been designed to isolate and marginalize communities of color. And they've been incredibly successful. And we've allowed this to happen. And we can't sit back any longer and allow this to happen. So I invite you to join me in speaking out and encouraging your employers, the healthcare organizations that are out there, the healthcare leaders that you work with and that you know. Encourage them and let them know that this is the time for action. If ever there was a time to jump in and address disparities in healthcare across America, this is the time. Encourage them, lend your voice to this effort, and let's have this become a movement. That's what we need. Don't let this become status quo again. Don't let us drift backwards as this pandemic subsides. Now is the time to make change. And change is only going to happen if we all speak out and we all commit to action. Now, I've heard lots of healthcare leaders speak out against racism and against systemic racism, but I haven't heard a lot of plans for how we're going to do that. So let's push. Let's make change happen. Let's be a part of change. Join me. Thank you.